Hello everyone, I am Dr. Deepa. Today we are going to learn about the new topic, that is the anastomosis around the elbow. The anastomosis around the elbow, which is also called as the cubital anastomosis. The word anastomosis itself means the connection or any joining between the two vessels. So we are here today to learn about the anastomosis surrounding the elbow joint. So the anastomosis around the elbow mainly occurs by the branches of the two arteries, that is the branches of the brachial artery and the profunda brachii artery, which is the largest branch of the brachii artery from above, and from below the branches of the ulnar as well as the radial artery take part in the anastomosis. So the anastomosis is from above and from the arteries below. So the branches taking part in the anastomosis from above are the branches of the brachial artery and the branches of the profunda brachii artery. The arteries which take part in the anastomosis from the below or from the distal end are the branches of the radial and the ulnar artery. As we have already studied, the radial and the ulnar arteries are the terminal branches of the brachial artery itself in the cubital fossa. The anastomosis is mainly seen to occur around the epicondyles. That is, the anastomosis is seen to occur around the medial and the lateral epicondyle of the humerus. So, the medial epicondyle and the lateral epicondyle. So there is anastomosis in front of the medial epicondyle, behind the medial epicondyle, and there is anastomosis in front of the lateral epicondyle and behind the lateral epicondyle. So this is your lateral epicondyle, the medial epicondyle. So there is anastomosis occurring in front and behind the medial epicondyle, as well as the anastomosis takes place in front and behind the lateral epicondyle as well. So the first anastomosis in front of the medial epicondyle, second anastomosis behind the medial epicondyle, the third anastomosis is seen to occur in front of the lateral epicondyle, the fourth anastomosis is seen to occur behind the lateral epicondyle. There is fifth anastomosing point which is seen to occur above the olecranon process of the ulna behind. So above the olecranon process, of the ulna is the fifth anastomosis taking place. So these are the 5 sites where the anastomosis takes place. So next we will look for the arteries taking part in the anastomosis. In front of the medial epicondyle, the anastomosis takes place in front and behind it. So, the anastomosis in front of the medial epicondyle is between the anterior ulnar recurrent, which is a branch of the ulnar artery, and from above, the anastomosis takes place from the inferior ulnar collateral branch, which is the branch of the brachial artery. So these are the two arteries taking part in the anastomosis in front of the medial epicondyle. So the medial epicondyle here. So there is anastomosis in front of the medial epicondyle, which is taking place between these two arteries, The arteries are anterior ulnar recurrent branch of the ulnar artery from below and the inferior ulnar collateral branch of the brachial artery from above. These are the two arteries taking place in front of the medial epicondyle. In the same way, there is an anastomosis which takes place behind the medial epicondyle. So behind the medial epicondyle, the anastomosis is between the posterior ulnar recurrent. So the behind the medial epicondyle, the anastomosis occurs between the posterior ulnar recurrent branch of the ulnar artery and the superior ulnar collateral branch of the brachial artery So these two arteries make up the anastomosis the behind the medial epicondyle. So these are the four arteries taking part in the anastomosis around the medial epicondyle. So this is about the anastomosis around the medial epicondyle. Moving on to the anastomosis around the lateral epicondyle. Yes, there is anastomosis in front of the lateral epicondyle and the anastomosis behind the lateral epicondyle. So the anastomosis in front of the lateral epicondyle is between the radial recurrent branch of the radial artery from below and the anterior descending branch of the profunda brachii artery from above. So these two are the arteries which make up the anastomosis in front of the lateral epicondyle. So this is about the anterior part of the lateral epicondyle, whereas behind the lateral epicondyle, the anastomosis is taking part between the interosseous recurrent branch of the posterior interosseous artery, which is in turn the branch of common interosseous artery here. So behind the lateral epicondyle, there is anastomosis seen between the interosseous recurrent branch, and from above it is the posterior descending branch of the profunda brachii artery. So the posterior descending branch from the profunda brachii and the interosseous recurrent branch from the posterior interosseous artery, which is in turn the branch of the ulnar artery. These two are the arteries taking part in the anastomosis behind the lateral epicondyle. So this is about the anastomosis occurring around the lateral epicondyle. So I repeat the anastomosis at all the four sides. So at the first, that is the anastomosis in front of the medial epicondyle is seen to occur between the anterior ulnar recurrent branch of the ulnar artery and the inferior ulnar collateral branch of the brachial artery. In behind the medial epicondyle, the anastomosis is seen to occur between the superior ulnar collateral branch of the brachial artery from above and the posterior ulnar recurrent branch of the ulnar artery from below. The third anastomosing site is the area in front of the lateral epicondyle. So in front of the lateral epicondyle, the anastomosis is seen between the radial recurrent branch of the radial artery from below and the anterior descending branch of the profunda brachii artery from above. The fourth anastomosing site is seen behind the lateral epicondyle between the interosseous recurrent artery, which is in turn the branch of the common interosseous artery, which is coming from the ulnar artery from below, and from above it is the posterior descending branch of the profunda brachii artery. So this is the fourth anastomosing point behind the lateral epicondyle. So these are the arteries taking part in the anastomosis in front and behind the epicondyles. So this is the atlas picture where we can make out the anastomosis between the arteries, which has been discussed right now. So here we can make out the collateral branches. We can see the collateral branches, that is the superior ulnar collateral and inferior ulnar collateral, which is seen coming from the brachial artery. So these two ulnar collateral, which are the branches from the brachial artery, takes part in the anastomosis around the medial epicondyle as discussed below, which is seen very clearly over here. Inferior ulnar collateral artery anastomosis with the anterior ulnar recurrent branch, whereas superior ulnar collateral artery anastomosis with the posterior ulnar recurrent branch of the ulnar artery. We can also see the anastomosis around the lateral epicondyle here. So when we talk about the anastomosis, as already been discussed, the lateral epicondyle, we have anastomosis between the branches of the profunda brachii and the branches of the radial and the ulnar arteries from below. Here we can see the descending branch from the profunda brachii. Yes, the profunda brachii descending branch, that is the anterior descending and posterior descending. The radial collateral, which has been mentioned here, is nothing but the anterior descending branch of the profunda brachii. Yes, the radial collateral is also called as anterior descending artery, whereas the middle collateral is nothing but the posterior descending artery, posterior descending branch of the profunda brachii artery, posterior descending branch of the profunda brachii. So the anterior descending artery, which anastomoses with the radial recurrent artery, and the posterior descending branch, which is seen to anastomose with the interosseous recurrent branch, which is seen to anastomose with the interosseous recurrent branch, as we can see over here, which is in turn the branch coming from the ulnar artery itself. This is the another highlighted view showing the anastomosis around the joint over here, the medial epicondyle and the lateral epicondyle. Very beautifully we can make out the anastomosis, that is the branches from the, we can see the recurrent branches from the ulnar artery from below. We can also make out the collateral branches from the brachial artery from below here, whereas along the lateral epicondyle we can make out the collateral branches or the descending branches of the profunda brachii artery from above and the recurrent branches from the radial artery as well as ulnar artery from below. So this is how the anastomosis is seen to occur. So we need to mention about the fifth anastomosis which is taking place. As I have already told, the anastomosis also takes place above the olecranon fossa. So above the olecranon fossa, there is anastomosis taking place between the transverse branch of the profunda brachii artery and the transverse branch of the inferior ulnar collateral. So this is the transverse anastomosis. Yes, this is a transverse anastomosis which is taking place between the branch of the profunda brachii and the branch of the inferior ulnar collateral above the olecranon fossa. So this completes the anastomosis around the elbow joint. Thank you.